So our next speaker is Dr. Mazvita Muchengeti, and she joins us from South Africa, where registry teams work in real time and they track cancer's true toll. Her frontline insights reveal what it takes and what it costs to make every patient count.
Thank you for the opportunity to share on cancer surveillance and registry systems in South Africa. My name is Mazvita Muchengeti, and I am the head of department of the National Cancer Registry of South Africa. Today I'm going to share about the legal framework and mandates that govern cancer surveillance, the functions of the National Cancer Registry of South Africa, and the role of cancer registry data in government policy. Starting at a global level, often heads of state and ministers of health meet at the World Health Assembly to decide on matters that govern health in countries. And such a meeting happened in 2017, and on the agenda item 15.6 was on cancer prevention and control in the context of an integrated approach. And the member state responsibility was stated as to collect high-quality population-based incidence and mortality on cancer for all age groups by cancer type, including measurements of inequalities through population-based cancer registries, household surveys, and other health information systems in order to guide policies and plans. This means that our ministers, our heads of state have signed up to this responsibility of cancer surveillance in their countries. Now, coming back home to South Africa, we have a national strategic plan for non-communicable diseases. So this national strategic plan includes cancer surveillance within. So it is important, as when we look at cancer surveillance systems, that cancer registration should be embedded in our national plans. Goal 4 specifically speaks to capacity building for high-quality research and development for the prevention and control of non-communicable diseases, and also monitoring strategic trends and determinants of non-communicable diseases in order to evaluate progress in the prevention and control. So when cancer surveillance is embedded in national strategic plans, this allows for governments to budget for it. If it's not even included in the national strategic plan, or there is no such a plan, then there might be no money allocated for cancer surveillance. Once again, we have a law for cancer surveillance. So in 2011, cancer became a reportable disease in South Africa, which means that reporting of cancer became compulsory. And Regulation 380 of the National Health Act of 2003 mandates the National Cancer Registry to conduct cancer surveillance. And it specifically states that the Cancer Registry should collect, record, validate, store, manage, analyze, interpret, and record all data relating to cancer. It mandates establishment of population-based cancer registration, which is the gold standard. Population-based cancer registration is when all cancers that are collected within a defined population, whether they are confirmed by pathology or clinical means or radiological means, or on this certificate only, they are all included. And Regulation 380 also it mandates National Cancer Registry to give information to organs of the state, such as the National Health Department, our Ministry of Health, and the general public. And this cancer data should be used for education and training. It should be used for awareness and research, for planning, including prioritization of cancers and interventions. So what this mandate does is that it gives legislative coverage to our reporting sources. Our reporting sources are comfortable to share identifiable data with us without persecution, without violating confidentiality, because there is legislative coverage that allows us to receive identifiable information for the purpose of cancer surveillance. So having such a law really improves cancer surveillance and really gives reporting sources the confidence to be able to share data with the registry. So the functions of the cancer registry are actually defined by Regulation 380 and their cancer surveillance, research and training, cancer awareness, and informing cancer policies. We have a pathology-based cancer registry that was established in 1986. So it is 39 years old, and this collects pathology-confirmed cancers from both public and private laboratories in South Africa. However, because it only has pathology-confirmed cancers, it is not a population-based cancer registry. It has a gap because clinically diagnosed cancers, cancers diagnosed by radiology, cancers that are on death certificate only are not in this registry. That is why Regulation 380 was put in place so that we can be able to establish sentinel-based, population-based cancer registry where we have nurses going into specific sites to do intensive active cancer surveillance. So we have these population-based sentinel sites in Ekurhuleni district in Gauteng, eThekwini in Zululand, in KwaZulu-Natal, and in the Eastern Cape. And we would want to establish 2 more so that we can have a sample that is representative of the diversity of the South African population, where we do intensive cancer surveillance and then use this to correct national estimates. We also monitor the cervical cancer elimination strategy by linking our cervical cancer screening program to the cancer registry and to surgical treatment of precursors. We look at surveillance of inherited cancers using the National Health Laboratory Service database, where if a cancer occurs in a very young person and it is suspected that it is an inherited cancer, this can then be used to trigger investigations for inherited mutations in the family through genetic counseling and genetic testing. We also do surveillance of cancer in people living with HIV. We have, in South Africa, we have over 8 million people who are living with HIV, making it the largest HIV epidemic in any one country in the world. So HIV is very important for us in our country. So we do surveillance of cancer in people living with HIV and compared to people in the general population so that we are aware of which cancers are occurring in people with HIV and how people with HIV can protect themselves if they have an increased risk of specific cancers. We also use our data for research and training, where honors, masters, and PhD students are using our data to pursue higher degrees. We also do childhood cancer registration, a standalone childhood cancer registry, because childhood cancer is one of the WHO priorities for cancer. Using these data in the pathology-based cancer registry, we use those to estimate incidence of cancer in South Africa. And the most common cancers in women in South Africa are breast, cervix, and colorectal cancer is the 3rd most common cancer in women in South Africa. Going to men, prostate is the most common cancer in men in South Africa, and colorectal cancer is the 2nd most common cancer in men in South Africa. Now looking at cancer incidence by population group, where we want to see what are the top cancers in white females, colored females, Black females, and Asian females. What is very apparent is that colorectal cancer has a higher incidence in white females, followed by Asian females, colored females, and lastly, Black females. This epidemiology that we see does not necessarily reflect the true incidence of colorectal cancer by population group because it shows access to care. Because of the differences in the socioeconomic status by race in South Africa due to our history, this shows that in Black females, they don't have as much access to surgical care and consequently diagnosis of colorectal cancer and all our cancers compared to the other population groups. So this reflects how social inequalities affect the cancer incidence data that we have. When we look at men, we see similarly white males have the highest incidence of colorectal cancer, followed by Asian males, colored males, and lastly Black males, also reflecting the inequalities from the most privileged to the least privileged population groups in the country. When we look at mortality data, we find that colorectal cancer is the fifth most common cause of cancer death in South Africa. So because it is in the top 5 of incidence and the top 5 of mortality, colorectal cancer makes it to the top 5 priority cancers in South Africa. We have developed a national cancer strategic framework, which is our cancer policy in South Africa. So this framework was from 2017 to 2022 and has since expired, but we are in the process of updating it. However, what is still in the framework is still very much applicable, and many of the things have not yet been achieved. So in this framework, we defined the priority cancers for South Africa as breast, cervix, prostate, lung, and colorectal cancer. And it is the data from the cancer registry that defined the priorities. And +1 is childhood cancer because it is a World Health Organization priority. So when we looked at these priorities, it is the data that has driven the priorities so that the most common cancers are the ones that we put the most resources to. In summary, the legal framework for cancer registration is the first step towards establishing robust cancer surveillance systems. Legal frameworks not only protect reporting sources to report identifiable data safely, but they also ensure that there are budgets for cancer registries because governments work on policies, they work on legal frameworks, and that is how budgets are allocated. So if there is no plan, then there will be no budget. Colorectal cancer is a priority in South Africa based on local cancer patterns. So this is a priority that we have defined based on the data that we have. And it is always good that countries define their own policies based on their own data. So that's why it is important to have robust cancer registry systems so that we define our priorities on our true incidence, not on misleading data. There are disparities in access to care by race. So access to care masks the true incidence. If people are not even accessing diagnosis, they are not being counted. So access to care is a gateway to having true incidence and mortality of cancer. Accurate data enable prioritization of cancer and data-driven cancer control policies. What is then the role of cancer registry in government policy? Prioritization of cancers for resource allocation and research. identifying inequalities and high-risk groups. After identifying these high-risk groups, risk stratification, so people know how much risk they have, and communication of this risk. These data are also used for informing screening strategies, because if people know the median age at which people are getting cancer, they know at which age should screening start in their own country based on their own cancer patterns. Data from the Cancer Registry informs targeted interventions where you have identified high-risk groups and when you know the age at which most people are getting cancer. And if there are any changes in the age at which people are getting cancer, our interventions are informed. And there are also, cancer registry data can also be used to evaluate our cancer policies. If we've put in place a policy, a prevention policy, we should be able to check the incidence, whether the incidence has changed, whether the mortality has changed, whether the survival has changed since we put some policies in place. So collectively, what cancer registry data does is that it achieves precision public health. That is public health planning that is precise and driven by data so that it is tailored to best help the country where the work is being done. I would like to thank you for your attention, and I hope that you can support cancer surveillance work in your respective countries, and you can support the development of laws that govern cancer registries. Thank you.
Wow, thank you so much, Dr. Mazvita Muchengeti, for such an amazing presentation. Your statement, if there is no data, there is no plan, leading to no budget. Wow. Your explanation of the National Cancer Registries and the work in South Africa and the efforts to strengthen cancer surveillance, including making cancer reportable disease, shows how policies and persistence can turn data into accountability. So it's time for a poll. In your country, there are laws that protect institutions collecting identifiable data and cancer. So does your country have laws that offer legal protection to institutions collecting data? Yes, no, or I'm not sure. And just so that you know, this really does help us. We're truly trying to make a difference, and we'll give you 15 more seconds. Whoa, that's not even close. 42% of you said yes. That's amazing. That's amazing. So this is definitely on point with what our theme is for countersign, data, dignity, and disruption. So thank you so much.